Last year, 1 in 30 NIH-funded clinical trials were disrupted by the Trump administration's. In less than 6 months, the Trump administration terminated 383 active NIH clinical trials. That included 118 cancer clinical trials. I think we deserve an answer.
Senator Murray.
Thank you, Mr. Chairman. NIH funds thousands of clinical trials around the world for families. These trials really represent hope and a chance for new treatments and cures. But last year, 1 in 30 NIH-funded clinical trials were disrupted by the Trump administration's grant terminations. It affected more than 74,000 trial participants. Dr. Bhattacharya, what do you have to say to patients who are receiving that life-saving treatment whose clinical trials were impacted by those cuts?
Well, Senator, we made sure that if there was any disruption, that the researchers had resources available to make sure that the patients receive continuity of care. Ultimately, we worked with researchers across the country to make sure that the clinical trials were really focused on advancing health and not on other political agendas, and renegotiated them. Ultimately, we have preliminary estimates that I think ultimately ended up maybe only a dozen clinical trials were terminated rather than...
Again, my time is short. Let me just say that the Trump administration terminated or froze 5,478 NIH grants last year. In less than 6 months, the Trump administration terminated 383 active NIH clinical trials. That included 118 cancer clinical trials. Those patients are in a race for time. Can you guarantee to us today that NIH will not terminate grants in this wide-ranging haphazard way again this year?
Well, Senator, I mean, most of those trials were restored after...
My question to you wasn't going backwards, it's going forwards. Do you guarantee you will not terminate any NIH grant trials this year?
I mean, Senator, it's in 2020, a very large number of clinical trials were terminated during. It's hard to predict the future, but what I will guarantee.
Clinical
Senator, can I just real fast? I mean, I can guarantee that we will focus our clinical trial efforts on advancing health and not on ideological fights.
Tens of thousands of real people rely on these clinical trials. It's not easy to get into them, and I think we deserve an answer that's much clearer, more direct than you just gave. Let me move on. This time last year, all of NIH's institutes and centers were prohibited from holding advisory council meetings, which is the final step. It is mandated by law before NIH can award any grants. Under your leadership, advisory council members have not been replaced at the end of their terms. And for the first time in NIH's 139-year history, you completely disbanded the advisory committee to the director. It has not met in more than a year. More than half of NIH institutes are set to lose all of their voting advisory committee members by the end of 2026. In fact, one of the institute's councils is going to have no members by the end of this month. Since grants cannot be funded without council approval, this poses a very serious threat to NIH's ability to fund research. Tell us how many institute advisory councils and other review panels have been disbanded under your leadership, and tell us how you're going to fix this.
So I've ordered the institutes to nominate new members. We're working as fast as we can with dozens and dozens of new members, including for the advisory committee director. I just sent up a slate. We're going to have those faculty committees working. There will be no delay.
Well, if you can provide this committee, please, with information on the status of every one of these councils and your agenda for getting them done. This is you can't by law extend any research dollars until those are in place, and without any members, there's no
money. It's a priority of mine to make sure that those councils are staffed.
Okay, one more question. 2 weeks ago, NIH issued a ban on fetal tissue research. This policy immediately halted all research that has led to groundbreaking medical advances, from the development of the polio vaccine to IVF. This stops irreplaceable research in a new treatment for everything from Alzheimer's to Parkinson's. What is the scientific evidence for you banning fetal tissue research?
Well, as I said earlier, fetal tissue research has been declining in use because of the availability of new alternatives, including induced pluripotent stem cells and a whole host of other new technologies. We did a study, an investigation, to make sure that the impact, the scientific
But you
impact.
don't have any evidence that you're going to put it in front of us. You're just saying something else is there, and there's not always better alternatives. And in fact, for stem cell research, there's very, very limited. So,
Just one more fast.
you're not presenting us any. It seems. I'll tell you why I'm asking. This seems to me like a political decision by NIH. You made the decision right when we were having a mass gathering of anti-abortion activists here in D.C., so you can see why all of us go, what's this about? But I am very concerned that NIH issuing this ban with very little notice is going to have a huge impact on patients in this country. And I want you to commit to providing to us a complete list of affected projects so we on this committee know what's been terminated, hopefully by the end of this week.
Absolutely, you can have that. But I'm telling you, we did not do we didn't terminate projects. We recommended that we required that the scientists find alternatives, and there are alternatives available. Using tissue from aborted embryos, aborted babies is not necessary for science.
We've been around on this topic many times. We know full well the scientific research that this enables and what is being cut off. And in fact, what is really disconcerting is your announcement that NIH is threatening the use of human embryonic stem cells. That will affect upwards of 600 NIH projects totaling $325 million. Mr. Chairman, you can bet I'll be following this very closely.
Two topics for you today. I want to start on the question of public trust. You were talking about it earlier, public trust and public health. One of the things that so badly undermined public trust in the NIH in particular, and I think you addressed this when you were before the committee the first time for your confirmation hearing, was the work that NIH did and funded at the Wuhan Institute of Virology for coronavirus gain-of-function research, and of course lied about it. For 2 years or more, NIH denied that there had been any funding whatsoever that had gone to Wuhan, and then ultimately had to admit after public reporting that indeed there had been gain-of-function research with NIH money through EcoHealth Alliance that had gone to Wuhan. My question to you is this: has the NIH done under your leadership now a thorough review of all of the grants or other funding streams that may have gone not only to Wuhan, but to other labs in China? Do we have a handle now on what NIH was doing over the last decade plus in funding? I think this is so important because we were misled. I say we, I mean the American people were misled and lied to. And those of us who said, wait a minute, we think there's a funding stream there, we were called conspiracy theorists, kooks, crazies. It turns out it was 100% correct. So has NIH done a review of what funding streams have gone to Wuhan and to other labs?
I've been focused primarily on making sure that we don't currently have or in the future have. So I put in policies to have better oversight of foreign collaborations. I've worked very hard on the dangerous gain of function. We paused 40 grants that have some potential risk of dangerous gain of function and put in policy so that never happens again. Because to me, that's the most important thing. We can't ever do it again. I'm working on the review. It's a long review, and and I'd love to work with Congress, and it's something that other parts of the administration are also interested in. It's a long, complicated story that unfortunately doesn't just involve the NIH. It also involves partners, foreign partners, and so I think it's something that we really should do, but we haven't. I can't tell you we completed it.